right, good morning, everybody. Good morning to the Illinois Harm Reduction and Recovery Coalition. Yeah. You're here! Welcome. Okay, well, hello, I'm Chelsea Laliberte Barnes. I'm a licensed clinical social worker, beloved sibling of Alex, who died from an overdose in 2008, and the co-founder and co-chair of the Illinois Harm Reduction and Recovery Coalition. For the sake of brevity, we'll say IHRRC. Alongside me is our co-chair, Dr. Tanya Sorrell, who you will hear from shortly. We are a statewide movement comprised of hundreds of passionate individuals and organizations who are dedicated to ending stigma and fighting for legislation advancing peer-led harm reduction and recovery, led by those with lived experience and for those most impacted by substance use and overdose. Our members represent people on the front lines of this ongoing devastating opioid overdose crisis, outreach and peer support workers, people who use drugs, participants of treatment programs, community, loved ones who have died from an overdose, legal advocates, legislators, doctors, nurses, social workers, you name it. When you hear about overdose deaths decreasing, you can thank our members. They're the reasons why our overdose deaths have gone down in this state, where they have. This coalition believes in evidence-based and community-led programming to save lives by distributing naloxone, drug checking, safe use, and safe sex supplies through culturally humble mobile and pop-up outreach services, promoting empathy-driven and evidence-based recovery support and mental health treatment, preventing the spread of HIV and hepatitis through education, testing, counseling, and medical therapies, providing advocacy, ensuring people live a dignified life through housing first models by facilitating supportive shelter, job training, placement, food, basic needs, IDs, and beyond. We find it disrespectful and ignorant that people think harm reduction is enabling, but let's roll with it. We do enable. We enable people to connect. We enable people to have hope, live full lives, feel supported and loved and believed in. We enable life. Because without a pulse, any positive change is simply not possible. Recovery is not possible. I'm going to call up Dr. Tanya Sorrell, and she can tell you a little bit more about the statistics.
Good job.
Thanks, Chelsea. And good morning, everyone. My name is Tanya Sorrell. I'm a psychiatric nurse practitioner and director of Rush's Substance Use Center of Excellence and the co-chair of the Illinois Harm Reduction and Recovery Coalition. The work that researchers in collaboration with harm reductionists is the reason that we're seeing the decrease in numbers that we did for 2023. But we know that although that's positive, that's not enough, because our work remains necessary to not only to continue to decrease overdose deaths, but to provide the appropriate services, care, and support for people who use drugs. The numbers with the 8% decrease in overdose deaths in 2023, it also showed that the groups, Blacks, Latinos, rural and other marginalized groups, were still at the highest risk for overdose deaths in our state. And they have the least access to the services needed to be able to move them in a positive way for any positive change. Particularly, Black men between the ages of 35 and 65 continue to have the highest risk for overdose deaths, despite all of our collective efforts. And that those folks, when they are wanting services, only 80% that are looking for services still have problems with accessing care, services, and support because of stigma and discrimination. This means that we have to provide the services that are not only needed to decrease the risk of overdose death, but to provide that care, support, and the services so people who use drugs don't just survive, but they're able to revive their lives. So the Illinois HOPE Act serves to do just that, to not only prevent death, but to support, promote, and enhance a full lived life of recovery. And I'm honored to be a part of the great work that we're starting here. Chelsea? I certainly will. So, yeah, we're going to introduce you. And so the lead for this program, and certainly one of our biggest behavioral health advocates alongside Rep. Ford, is Representative Lindsay LaPointe, who is the lead and sponsor of this important bill. Rep report.
Good afternoon, everyone. Love talking about harm reduction. As the chair of the Mental Health and Addiction Committee in the Illinois House, as a licensed social worker myself, as somebody who has done street outreach with people experiencing homelessness, access to affordable behavioral health care is a top priority for me. It's a top priority to the people standing behind me. Whenever I'm at a mic and I talk about behavioral health care, I like to unpack that we are talking about mental health care, we're talking about addiction, we're talking about recovery, we're talking about trauma support, and we are talking about harm reduction. All too often, the harm reduction component of behavioral health gets the short shrift. Behavioral health as a whole can get the short shrift too. The way I think about it is physical health care is at the dining room table, the fancy dining room table. Behavioral health care is at the kiddie table. Harm reduction is in the doghouse. That is how it has been historically, and that is what we are trying to change. The budgets have been tiny for our harm reduction lifesavers and our nonprofits. The staff have been underpaid, or let's be real, not paid at all. And our harm reduction nonprofits have had to fight like hell for funding and for legitimacy. As we said at a press conference last year, I think it was in April, harm reduction has to go way beyond naloxone. Naloxone is important, we love it, but harm reduction is so much more than that. And that is where the new HOPE Act, the Holistic Overdose Prevention and Equity Act, comes in. And that is a bill we intend to file today. We are waiting for the language to come back from LRB. As we know, LRB is pretty busy at this moment in time, but I do expect to file it later today as a standalone bill. This will be the first comprehensive package since 2019 to really amp up our approach to harm reduction in Illinois. The people of Illinois, the people struggling on the street, the people who use drugs, our people who use drugs, and the people standing behind me deserve that. So I'm going to take a moment and just tick through the bill. I'm going to try to do it pretty quickly because we have others to hear from. Okay, so the HOPE Act. First, it will expand access to care in jails and prisons. People incarcerated with substance use disorders will have access to the medications they need while they're incarcerated and access upon release. Every single person leaving jail will get naloxone, which of course is life-saving medication, along with education on overdose prevention and referrals to a harm reduction provider. Next, the bill tackles low barrier housing, meaning housing that people need access to without jumping through 50 hoops first. We know that stable housing is paramount to recovery, so the bill directs community-based providers to prioritize housing before other needs, prohibiting, rejecting, or evicting residents solely due to sobriety requirements, or solely due to criminal histories, or solely because somebody is on a regimen of medication-assisted recovery. Next, the bill strengthens harm reduction efforts across Illinois by creating a harm reduction program board. And that board would include legislators, public health experts, people with lived experience to guide policies and to guide our efforts statewide. We don't have any centralized place for that. And even the activities now, some are funded through DHS, some are funded through the Illinois Department of Public Health, some are funded through our opioid settlement funds. The bill also includes the creation of a chief harm reduction officer who will oversee all those efforts. In terms of harm reduction education and training, healthcare professionals will be required to complete harm reduction training for their license renewal. The number of doctors who do not have the basic literacy that they desperately need on addiction issues is very troubling. It is very troubling. And so we need to work it into their regular licensure renewal process. And that obviously goes for behavioral health care too. Local government agencies will have to train on the harm reduction laws currently on the books. We have passed some really important harm reduction laws in Illinois, but we have local governments and some law enforcement that are not abiding by those laws, and that is preventing people from accessing care. Specific to hospitals, the bill will require hospitals to offer medications for opioid use disorder and naloxone to patients who need it. Hospitals will also have to test for fentanyl in drug screenings and report those results back to the state so we can track trends, and in particular, track where fentanyl is. Fentanyl has been the boogeyman. It has been used to take away harm reduction. We need to double down and get more harm reduction because, yes, these drugs are deadly. We know that all too well. The people standing behind me know that all too well. The bill provides vital funding for harm reduction programs through grants, which can cover things like syringe and sterile supplies, drug checking, naloxone, HIV and hepatitis services, outreach, that's human outreach, that's making sure people are paid to do this life-saving work, research, and staff compensation. The bill prioritizes hiring people with lived experience, ensuring that harm reduction in Illinois is actually informed by that real-world knowledge. We're behind when it comes to that. We have lots of organizations getting funding for harm reduction, and they're actually not well-suited to do it. But there are other organizations that very much are. Finally, the HOPE Act protects harm reduction services from being unfairly targeted. The bill ensures that municipalities and local governments cannot keep legal harm reduction programs out through discriminatory zoning laws. This is healthcare that we're talking about. It is healthcare. It should be on the same plane as physical healthcare and other parts of behavioral healthcare. So at its core, this bill, and again, we hope to introduce it later today, is going to create some real strong infrastructure within our state laws related to harm reduction, because we know that's what works to truly put stigma aside and get people the real resources they need so that every person has access to support to not just survive and stay alive, but also to heal, to actually recover, So that is what the HOPE Act is about. Next, I'm going to turn it over to Becky Levin from TASC.
Hi, my name is Rebecca Levin, and I'm the Vice President of Policy at TASC, TASC, or Treatment Alternatives for Safe Communities. For almost 50 years, TASC has provided case management to people with substance use disorder who are involved in the criminal legal system as an alternative to incarceration. And for most of that time, TASC has been licensed by the state of Illinois under what is now called the Substance Use Disorder Act. And except for a couple blips that we aren't going to get into right now, TASC has received significant and sustained funding from the state of Illinois. TASC can accept referrals from all 102 counties in Illinois because we know that the state values the services that we and other behavioral health care providers offer, and the state is committed to making sure those services are as accessible as possible. When TASC provides case management, we meet our clients where they are to address their individual needs. For a lot of our clients, this means connection to treatment and recovery supports. For way too many of our clients, it means meeting basic needs like housing or employment. But none of our clients will have the opportunity to pursue a path outside the criminal legal system unless we meet their needs for health and life. Behavioral health care providers rely on our partners in harm reduction to make sure that our clients have access to safe supplies to prevent infectious disease, to warn people about emerging adulterants in the drug supply, and to ensure that the experience of people who use drugs are centered in our outreach efforts. Simply put, the heroic efforts of our harm reduction colleagues help organizations like TASC keep our clients alive. Unfortunately, Illinois, like much of the rest of the nation, has undervalued harm reduction for far too long. Now, I won't try to tell you that any part of the continuum of services and supports for people who use drugs is adequately resourced, but make no mistake, we do need a full continuum of services and supports, and we need to start prioritizing harm reduction as an essential part of that continuum. The HOPE Act offers a mechanism to provide the investments in harm reduction that we so desperately need in Illinois. The HOPE Act is based on the input of people with lived and living experience, including people who use or used drugs, people who have lost loved ones to overdose, and people running harm reduction programs. The HOPE Act calls for sustainable state funding of harm reduction and recognition of the expertise of the harm reduction sector. In other words, the HOPE Act will officially fill in the missing piece and arguably the most important piece of the continuum of health services for people who use drugs by fully recognizing their humanity and truly valuing their lives. Thank you. And I'll turn it over to Dr. Sorrell.
Just to give you a little background on what I see as a provider, our Rush Substance Use Disorder Center of Excellence trains medical providers in culturally sensitive behavioral health and substance use care and organizations so that we have best practices for stigma-free services and treatment. But while Illinois has decreased the overdose deaths, we've not followed that up then with the necessary support and services for comprehensive behavioral health and substance use that's needed to then keep people alive and healthy. When there's a vacuum, then there's going to be a gap. And sadly, persons who are using drugs and those that may be even ready for treatment are then having to wait or be on wait lists until those programs may open. And in the meantime, they may have an overdose or may be lost while waiting. Help must be comprehensive, so not just services to prevent overdose or medical complications, but more importantly, services that really help support somebody, a wraparound service to make sure that someone is staying alive and getting the support and care they need until they're ready for treatment. That radical wraparound support, basically putting the care back into healthcare, is what the HOPE Act does. Our best outcomes are when doctors and nurses partner with harm reduction specialists and then actually learn the techniques that they can employ in hospitals and in their clinics so that we have improved outcomes and then continuity of care on discharge and follow-up. Research shows that a peer support, someone with lived experience, is actually the best role model to help someone that's using drugs stay alive and then move towards recovery because they've been there. But our current regulations become a barrier to even hire a peer support because they don't meet the criteria to be able to work alongside of us. And then that prevents a person that's in recovery from fully regaining their lives, their work or employment, and then that prevents them from being able to help the next person that they could be able to provide care for. My work provides training for medical staff to provide assessments and medications for opioid use disorder in emergency departments and to help people gain recovery. But due to stigma and honestly discrimination, only 1 out of 10 patients that's seen in an emergency department is even asked about receiving medications for opioid use disorder. The HOPE Act then empowers hospitals and clinics to do the right thing in Illinois. You know, people know that Prince, the rock star, died from an opioid overdose, but most people don't know that he was seen in an emergency department of Illinois 4 days before he died. He was revived with Narcan and sent home with nothing. And just like him, if we can start patients on life-saving medications in an emergency department, we can save them. And those are our uncles, our cousins, our brothers, and all of those who need to be able to have that wraparound peer support service, that support in the emergency room, and no stigma, no judgment, just like my sign says here when they talk about drugs. With over 90% of deaths involving fentanyl, the toxic drug supply needs us to have a change in how we look at what we do and how we treat, because hitting rock bottom is now sadly an overdose death. The HOPE Act adds substance use services and supports, and then treatment and recovery for those in jail, in housing, and in crisis to keep people alive and then minimize their risks. The services provide care and support and addresses those social determinants of health that are always a barrier to being able to regain their lives. Those barriers to care or poor access to treatment, if we don't work on those and fix those, they'll continue to result in poor outcomes. But without the HOPE Act, we won't be able to bring the hope back for persons who use drugs. Let's do that with this bill and put the care back into healthcare through the Holistic Overdose Prevention and Equity Act. Thank you very much for letting me speak to you today. Now I'd like to invite one of our health harm reduction specialists and experts, Jen Nagel.
Hey everyone, apologies for my voice. I'm not feeling up to speed today, but I wanted to come here today. I could not miss this. First, I want to say thank you to Chelsea and Dr. Sorrell for your ongoing support and allyship, and for your invitation to speak here today. And of course, to Representative LaPointe and Representative Ford for taking up our urgent call to action. I'm standing here today simply because I do not know what else to do with my grief. It is what it means to show up in harm reduction right now. You carry your grief in one hand and your rage in the other, and somehow you keep going. You just do. You show up underfunded, under-resourced, overworked, and overwhelmed because people's lives depend on it. And I want to say this very clearly. We are not okay. We're not okay. We're not okay watching our communities suffer while those who are in power debate whether or not we're worth saving. We're not okay losing more friends, more participants, more brilliant, complex, and beautiful people to a system that criminalizes their survival and punishes their pain. This work is intimate, it is messy, it is raw, but it is beautiful. Like it or not, it's also political. And we're here to say that this is a breaking point. All of these rollbacks that we're seeing right now are not abstract policy shifts. Make no mistake, lives will be lost if things don't change. And if they don't change now, it is urgent. All of the decreasing overdose fatality statistics that some of us have been celebrating will be no more. There's no more celebration. There shouldn't be one anyway. Human rights are actively being erased. They are attacks on our bodies, our autonomy, and our existence. We've been told to wait, to be patient, and that help is coming. We've been taught by history that no one is coming to save us. We don't need saving anyway, guys. Newsflash. Instead, we will continue to do what's right, and we will continue to save ourselves because we cannot look away. We need people to stand beside us when it's hard, when it's risky, when it might cost you something. Harm reductionists have the courage to stand up to injustice and say and do what is necessary because it's simply the right thing to do. We need to remember those who never stopped showing up and their lives were lost because of it. This is for Dan and Karen Bigg, who laid the groundwork across the state and the country and have mentored many of us who are in attendance today or who might listen later, who prove that you really shouldn't have to ask permission to do what's right to save lives. This is for Mark Kinsley. This is for Dane. This is for Billy. This is for parents like Diane, Sue, Amy, and Tamara, who had the courage to stand often alone in their disenfranchised grief because they chose to not let their grief be co-opted by platforms that seek to exploit their loss and weaponize it against others. Parents who refuse to join the chorus calling for more punishment, more policing, more tough love, more war on drugs prohibition, and more shame. We need that kind of courage now, more than ever. Let us be clear. What we are collectively experiencing right now across our country, all of it, all the changes, all the rising tide of hate, it is a strategic movement to erase the lives and the existence of marginalized people. It is who is allowed the right to self-determination and options for care and health, wellness, tools, and compassion. Excuse me.
You're doing great.
Wellness, tools, and compassion, non-punitive support, and treatment instead of punishment. This is about erasing justice and equity. This is life and death. If you say you support harm reduction, if you say you support public health and bodily autonomy, if you benefited from our labor, our hard-won practical knowledge, and our lived and living experience, those of us who do work on the ground and have been doing it for years, If you benefited from our network of trusted colleagues and access to our participants' lives and our program data, we need you to stand with us. This moment demands action and solidarity. Thank you.
Thank you. And let me just thank all of the advocates for being down here and standing for the people that can't be here and pushing for harm reduction. I have a friend that passed away. Many of you may know him. His name is Dennis Deere, Commissioner Dennis Deere, and he would always say, what is the definition of insanity? And it is to keep doing the same thing over and over and over again. So I want to thank Representative Chairwoman LaPointe for bringing us hope. Because this is not doing the same thing over and over. Yes. This is actually doing it differently, and we're teaching people that really don't understand that we've moved from the point of just say no to just say yes to helping people. So hope is what we need, and I look forward to being a partner with you and all of you to help pass the HOPE Act. And it talks about harm reduction, and I cannot leave without bringing up Sheila from the Oak Park, who has an idea about one of the best harm reduction tools in the books. Sheila.
Thank you, Rep. Ford. I'll be very brief. This is my son, David. David died of a fentanyl overdose alone on a CTA train in November of 2021. He had Narcan on him, but of course he was by himself, so he couldn't revive himself. I'm here because the HOPE Act will bring together so many elements of harm reduction in our state, so it is about connection. Connection is what harm reduction is about, because when we connect with people, see them as human beings, accept them as they are, and help keep them alive, their chance of change is really bigger. It's also about costs, because I know David overdosed many times, was revived by paramedics, police were involved. When I think of all the dollars that went into those elements, I'm sure it was thousands of dollars, and how harm reduction can really help lessen those costs on our communities. But finally, it's about harm reduction. Narcan, which is something I've become a trainer on, is such a wonderful opioid reversal tool, so easy to use, everyone can do it. And when we think of harm reduction, we always start our trainings. I live in Oak Park, so I train for the Village of Oak Park. Think about harm reduction. Sunscreen is harm reduction. Bike helmets are harm reduction. Condoms are harm reduction. Seat belts are harm reduction. So there's all sorts of harm reduction we're already doing. This is just moving in the other direction, as we were saying, about elevating mental, behavioral health to the same level as other things. And I'm so deeply honored to be here in the company of such greats. David is not the face of this epidemic. We know it impacts communities of color so much more, but I'm honored to raise my voice and hope that the HOPE Act will pass. Thank you.
Sheila, thank you for your powerful words today and in our committee hearing earlier. We know we have another press conference coming in, so we're not going anywhere, but we are going to end and we can take questions standing out in the hall so we can accommodate the other folks coming in.